Okay, today we're going to go over the Bell Medical Catalog and how to best utilize this for a sales call. And what I would recommend that everybody do is have a 30-second commercial on themselves and a 30-second statement about Bell Medical, maybe even less than that. But what I would typically say is, if I was introducing myself in this catalog, I would say, hey, I'm Kevin Luters with Bell Medical. I've been selling medical products since 1986. And I represent Bell Medical. Bell Medical has been specializing in anesthesia products since 1975, and they have introduced new and innovative products. That's basically their our role, basically. We've introduced Drape anesthesia machines to the market. We were responsible for introducing Nellcor, pulse oximetry. So we take new technologies that are developed, even a specialized airway from an anesthesiologist perhaps, we'll take that product and market it for them. So basically when we see new technologies, we help bring them to the marketplace. So I believe that's Bell Medical's role, and myself as your local area sales rep is here to basically provide this information, and then as you purchase from Bell Medical, make sure everything goes smooth and you don't have any issues or problems. So I'm here locally to service you. So Bell Medical specializes in anesthesia products, and we're going to go over this catalog at this time. So I'm going to go down to the catalog, and those that are on video, fantastic, you'll go through this with me, and those that are on maybe telephone, hopefully you'll have a catalog in front of me. First of all, what you see on the Bell Medical catalog is our Insight Airway Management System. And to start off, I'd like to point out that we do a specialty introductory device for intubation. It has a flexible scope, it has a video laryngoscope, and it has a malleable rigid stylet. The interesting thing about these products is they all use the same video display. It's a 3.5-inch high-def display that can be removed for cleaning of the scope and removed and shared with multiple devices. And we'll talk about that a little bit more on the section that goes into them. But basically, that's kind of our Insight system overview, and then we'll get into it a little bit more in depth. It actually shows Insight, again, the whole system, and some basic pricing on how you can purchase it. Bell Medical also services anesthesia machines, and we provide general biomed services. So it's important for customers to know, especially an anesthesia department that's maybe a surgery center that has 2 to 4 anesthesia machines, we would love to bid on their anesthesia service. We pay a 10% commission to any sales rep that provides us a lead that we close on that has service. So we will travel anywhere across the country to service 3 or more anesthesia machines. Okay, and then we provide general biomed services. There is an index here, and then we get to our products. So starting off, we do have a website that has all the generic products like airways such as this, but this catalog is designed more to introduce a customer to our specialty products. And I would love to have you leave multiple copies of this to a large department, but the key people we want to leave this to is an anesthesia tech, the chief of anesthesia, maybe an anesthesia workroom, just leave it on a table. But in general, what our ideal situation is to present this catalog to the individual anesthesia tech or the chief of anesthesia or chief CRNA. So handing the catalog to them and assuming they'll page through it is not the ideal scenario. We want to page through it with them and give them an understanding of what you represent for Bell Medical. So as we go in here, we do have basic airways. But one of the neat things that we have is some specialty airways. This is a breakaway airway that allows you to use a fiber optic scope or other devices such as a bougie, and basically send an endotracheal tube through the airway. Then the airway can be broken apart so that the airway can be removed and they just have the endotracheal tube in. So this is an airway that was available 10 years ago, and Bell Medical has brought it back. It's only available in an adult size, but I've shown this to different professionals, anesthesiologists, for example, and they get very excited that we provide it because they remember using it and they haven't been able to get it. We also have some various other airways that are used for using a video laryngoscope or endoscope, such as a flexible scope. So that's kind of our specialty airway page. One of our focus points and opportunities in specialties is capnography. So we like to tell a customer that we can do whatever they need for capnography and often save them a significant amount of money. When you get to capnography, we want to understand what they use now. So if you can, say, what do you use now for nasal cannula? Do you use a mask that measures CO2? A lot of them are using a mask, an oxygen mask, that they are MacGyvering by putting a gel-co catheter through one of the holes and attaching a sample line to the gel-co catheter. And that gives the presence of CO2, but it doesn't give a good waveform and a good end-tidal CO2 number. Our mask here, this one is the Capno mask and the Capnoxygen mask, are both oxygen masks that are designed to give you a good reading for CO2. In anesthesia, they call a procedural sedation or a conscious sedation a MAC case. MAC stands for monitored anesthesia care. So you could ask an anesthesia provider, what are you using now if you wanted to use a mask for monitored anesthesia care? Are you MacGyvering a oxygen mask to be able to sample CO2? And if they say yes, then either the Capno mask, which has a vanilla flavor that is designed to reduce PONV or post-operative nausea and vomiting in the OR and PACU, they may want to try the vanilla-scented mask. It includes a sample line with each mask. We also have the Capnoxygen mask that more often we sell without a sample line, although they have a version that has a sample line also. But a lot of times anesthesia already has a sample line for monitoring CO2 hanging from their anesthesia machine, and they're able to just connect it directly to the Capnoxygen mask. So either one, we're probably promoting the Capno mask a little bit more because it has the advantage of that vanilla scent, and our pricing and costing is a little bit better. As you look to the bottom, though, you see an area that has to do with the procedural oxygen mask. The procedural oxygen mask, or Pom Mask, is a mask that we recommend showing. And often when you're going through this catalog, if you have one of those, you can present it at that particular time. But at a minimum, you would tell them that this mask has an orifice for them to be able to pass a scope through for doing an upper GI procedure. A lot of times they have procedures, and it's listed here, an ERCP, an EUS, or an EGD procedure, where they're doing upper procedures that sometimes last a pretty long time. And their main concern is they want to be able to have good control over oxygen, and they want to have the ability of monitoring CO2 during that period. So this mask has a great opening for the scope to be able to pass the scope through, and it allows you, it also has an oxygen reservoir bag as an option that will allow you to deliver over 90% inspired oxygen. Typically a nasal cannula such as this will deliver in the 30s to low 40s of oxygen, inspired oxygen, where this mask with its reservoir bag will be over 90. So once again, anesthesia is looking for a mask that will help them control oxygen and get a good monitor of CO2. And the Pom mask, or procedural oxygen mask, is a great mask to show them. We sell nasal cannula, and at this time when you talk about our split cannula, we would want you to ask them, what are you using now? What brand and what model number are you using now for your nasal cannula? Often they're using companies such as Salter Labs, and they're usually 7-foot cannulas. All of our cannulas are 10-foot and 14-foot, and they allow us to give them a longer length cannula, often at a considerable savings. We do also have a free Capnography monitor program, and that's why these prices are a little bit on the high side, or they are on the high side. But basically we will loan them at no charge a monitor to monitor their CO2 in return for them to buy their nasal cannula from us. So capnography in general is a major area for us in the operating room with anesthesia, and in the GI lab, once again with anesthesia and with nursing. Other capnography options we have is the Yrian capnography, compatible capnography system. So if they're using a sample line that has an orange or a yellow connector, that's an Yrian or a microstream connector. We now have Yrian microstream compatibility options that are about 40% less than Yrian. So they can still buy Yrian from Bell Medical, or they can buy the compatible Yrian, which means basically Yrian has lost their patent on this connector, and that's why we're able to offer an alternative at considerable savings. So once again, we have the Capnography with Yrian connector. We also have a connector adapter, if you would, that allows them to convert their system from an Yrian system to a generic system where they can use our generic Comfort Soft or our Blue Star cannula. Okay, so that's our Yrian compatible, and then we also sell actually Yrian stuff, or sample lines. If they're using anything with an orange connector or a yellow connector, we have an option for them that's direct from Yrian or MicroStream or a compatible source. As I turn the catalog, we get into catalogs. Now, just to go back to capnography, the main thing we want to do is we want to ask them what are they using now, and may we bid on their capnography supplies. I would ask the customer, are you in the market for any anesthesia carts, crash carts of any kind? We sell a malignant hypothermia cart that has a refrigerator in it. We sell difficult airway carts that have holders of flexible endoscopes. And then we sell fully configured anesthesia carts. And then we sell just basic crash carts that could be used for doctor's office, the emergency department, etc. So we have a complete line of carts. So we have a full catalog that's about a 1/4 inch thick that is a Bell Medical catalog that lists all the different options that will go with the cart. We just summarize it in 3 pages here and show some accessories. So once again, the question there is, are you in the market, or do you have any needs for anesthesia carts or crash carts at your facility? And if they don't, then you move on. We get to our CO2 absorbent page that talks about Amsorb Plus. We believe we're going to get approval to sell Amsorb Plus in all surgery centers. Right now, we sell it to hospitals and surgery centers in about 20 states, so your state may not allow us to sell it to the full hospital at this time, but we got some announcements coming. GE is about to endorse Amsorb Plus, and when they do that, they're also going to have the ability to sell Amsorb Plus. And if they have that ability, we feel that we've lost our exclusion and exclusive rights to it to a certain degree, although I think we'll still have some advantages. That hopefully will open it up so we can sell it across the country, at least in all the surgery centers. So Amsorb Plus, when you get to this page, you would just basically ask them, you know, what kind of anesthesia machines they have, and make a note of that, because that'll tell you what kind of canister they use. You would even ask them, what kind of absorbent are you using? And if they don't know, you could say, can you get me a canister that you use? They bring it out, you take a picture of it, or they may know, and that information is valuable for you later on in your sales process, because the key here is understanding what they're doing now. And if they bring that canister out, or you might even ask them, are you changing, how are you using that canister? Are you changing it based on color? Are you changing it every Friday, every Monday? Because there's hospitals that are changing it every day, no matter what, because there are concerns about some of the toxins that can be produced with soda limes. So the brief story on Amsorb Plus while you're on this page is that Amsorb Plus contains no sodium hydroxide. Sodium hydroxide is basically the bad chemical that produces toxins as a soda lime dries out. Amsorb Plus is not a soda lime because it contains no sodium hydroxide. As a result, Amsorb Plus cannot produce any toxins under any circumstances. There's other advantages that are listed here, such as that our absorbent is a permanent color change. Other absorbents will change blue as they're being used, or to purple, and then they'll change back even as early as an hour to 2 hours later, or definitely by the next day. With Amsorb Plus, when you are a third color change on a Friday afternoon, you come in on Monday, you're going to be a third color change. With other absorbents, you come in on Monday and you really have no idea where your absorbent is. So once again, when you get to the CO2 absorbent, you would ask them what kind of anesthesia machines they have, what kind of absorbent they're using, and perhaps what's their practice on changing it. So you would ask them, how do you currently change, or when do you currently change your absorbent? And they might say, oh, we basically change it on color change. And then you would ask, why do they do that? Sometimes anesthesia techs don't know why they're being asked to change it at a certain point, and the reason is those toxins. We are getting an endorsement from GE that will basically say GE Anesthesia recommends using Amsorb Plus because they view that our absorbent chemical is superior to any other chemical, soda lime or other offering, in especially regards to low flow anesthesia and the ability to make sure we don't have any toxins. So this is going to be a great. So once again, when you get to the absorbent page, you basically ask, can we bid on your absorbent business? We're getting into endotracheal tubes and endobronchial tubes. Salter Labs purchased Parker Medical. We've been a Parker Medical distributor for 20 years plus, and Parker Medical recently sold to Salter Labs. So we're now a Salter Labs distributor of Parker Medical. They have a couple unique devices. One of them is a double lumen tube or an endobronchial tube. And what this is used for is when they're doing chest surgery, where they might be doing surgery on one of the lungs. And what they'll do is they'll deflate the lung they're going to do surgery on, and they'll ventilate the patient on the lung that they're not doing surgery on. So it's basically a double lumen tube, so it goes down and it separates and is able to ventilate the left lung and the right lung. What's unique about our double lumen tube, and of course anesthesia understands what a double lumen tube is for, but what makes ours unique and advantage to them is, number one, we're about $5 less than Mallinckrodt, which is what the industry uses throughout. We make this upper part, which is all the connectors that fit on top of the double lumen tube. We have that pre-assembled and pre-packaged in the tube. We're in the package, whereas with Mallinckrodt they have to put this together. And I've actually had anesthesia providers say that there has been occasions when they've actually put the tube in and they look back and they haven't put this together. So to have this put together is a nice thing, and anesthesia likes having convenience. But the real key is that it is a clampless double lumen tube. Typically what they'll do when they're ready to shut off the left lung or the right lung is they will take a clamp and they will clamp off one of these sides. When they clamp off the side, that shuts that side off of the lung, and they're able to actually deflate that lung and then do surgery on it, and they're ventilating from the other side. With this system, we actually use a series of stopcocks. So instead of having to look for a clamp or use a clamp to clamp it off, we're able to move these stopcocks, and it will actually shut off or turn on the stuff. So basically our double lumen tube is $5 less expensive than Mallinckrodt. It comes pre-assembled and it has stopcocks, so you don't have to go look for a clamp to shut it off. Parker endotracheal tubes are unique in that they have a special flex tip. The flex tip has a soft tip, so when you tap it onto a hard surface, you barely hear it, whereas if you take a Mallinckrodt, which is cut off at a 30-degree angle, and you tap that on a table, you'll actually hear a knocking sound, and so it's a harder material. This will flex off tissues, and when I show this, I'll usually have the tube, and basically that tip will flex off tissue and then go through the vocal cords. It's a center-orientated tube, which makes it easier to go through vocal cords, and we have a price matching strategy. So even if they want to use it just for difficult intubations, it's a $3.50 endotracheal tube. But if they want to use it routinely, we have an area down here that says it's going to be revenue neutral. In other words, if they're buying Mallinckrodt for $1.60 or $1.45, we can sell them the Parker endotracheal tube for that same price, as long as they commit to using it on a routine basis in their operating room. So the key thing with this is it makes any difficult intubation easier. So we would always want you to have the Parker endotracheal tube when you're showing our other intubation devices. Parker also has special preformed tubes and wire reinforced tubes and specialized stylettes. We sell intubation tools of all kinds. We have a rigid intubation tube, that, or stylet, if you will, that's similar to a glide scope, and it's from Copilot, but it's basically the same as theirs. We now have a new one that's from Insight. That's even less expensive than this $45. This is a reusable one. We also sell reusable Eschmann stylets, that are bougies. And a bougie is basically something that has a little curve on the end that allows you to go into the vocal cords with a real small device, and then you take your endotracheal tube and you put it over the bougie, and then you railroad follow the bougie basically through the vocal cords, and that's how you do the intubation, and then you remove the bougie. So we have bougies of various lengths. We have an orange one that's only $5, or I guess it's $6, and then we have a blue one that's about the same price. That's a little bit longer. We have bougies that have orifices through them so that they can basically ventilate oxygen or send oxygen through while they're trying to get the tube in place. We also sell something called the control crike. So when you can't get a tube in, you have to have a backup plan, and that's basically criking a patient, which is putting a tube basically in their cricothyrotomy. So one of the unique things about our control crike is that it has a 5-year warranty or shelf life, and it's only $200. Our main competitor, which is Cook, is like $400, and they only have a 2-year shelf life. So we can sell both a trainer, which is non-sterile, and then we can also sell the sterile version. And they come in either individually eaches or boxes of 5. The control crike is there. Now we get into our intubation tools from Insight. This shows the entire system, and that's the biggest thing to be aware of and tell your anesthesia providers is we have a complete system. The only other company that we really kind of compete with that has a complete system would be Karl Storz. Karl Storz is incredibly proud of every one of their scopes and devices, for example, from a pricing standpoint. Every one of their flexible scopes is over $20,000. Every one of ours is under $10,000. And what's unique is our display will work on all 3 of our devices. The whole system we sell for about $20,000, but then you can buy them individually. So when you look at them individually, our flexible scopes, we have 4 different flexible scopes. We have a 4.0, we have a with, actually I think our largest one is actually the 5.8 with a channel. Then we have a 5.8 without a channel. We have a infant scope that's a 2.8 millimeter. That's the outside diameter. So if you have a 2.8 scope, that can be used for a 3.5 millimeter endotracheal tube. Basically, most of the people that are using these flexible scopes now are using them to verify the placement of a double lumen tube. So when you put these double lumen tubes, you need to put this point of the tube directly at the carina. So then what they'll do is they'll send a flexible endoscope, such as the Insight system, down that tube, and they'll look to where the carina is. In fact, this picture shows the carina and a branch off front to the different lungs. Whereas these pictures are actually showing vocal cords. So this is past the vocal cords, right down to the base of the trachea where it branches off into the lungs. So we have 4 different sizes, 2 with channels and 2 without channels, and that gives a clinician a lot of different flexibility on what to choose. And once again, this video display will fit on all the different channels, or all the different devices. We also have a rigid or malleable lighted stylet. This shows that it is flexible, so they can bend it to the shape that they want, and then after the procedure they can put it in a hot water bath, and the stylet straightens out to the original curve. So it's malleable, adjustable, but it goes back to its original shape. It has an endotracheal tube stopper, so you would preload your endotracheal tube here. You would lock it down so it ends up being at the end there, so it doesn't pass the this metal part doesn't pass the endotracheal tube, and then you would possibly connect oxygen to this so that oxygen is going through this opening and through the endotracheal tube, and so as you're using it, oxygen is being insufflated into your patient. So it's what I call a lighted malleable stylet. Some people call it a rigid stylet, but it is adjustable, and once again it uses our video display. Then we have our product leader basically because everyone's looking at using a video laryngoscope. The video laryngoscope for Insight is unique in that it has what's called a slider that slides out and in and allows you to use it for both infants all the way up to large adults. So it actually has 4 different size Macintosh endotracheal tubes. It has a Mac 1, 2, 3, and 4. So we are able to do from infant to the largest adult. At this page, it does show some of the display features that I think are important to point out. It is a high-def 3.5-inch display. It has actually a 270-degree rotation, and it tilts up and down, so it has a lot of flexibility with that regard. This device will do infants to adults. It has a 3+ hour rechargeable battery, so it'll work for 2+ hours easily without having to be recharged. It has a removable display, so it allows you to sterilize the handle. One of our key competitors, the McGrath, does not have a removable display, so it's difficult to sterilize theirs. We have Wi-Fi and a remote to a remote display, both via Wi-Fi or a USB, actually an HDMI cable to present. So you can either cable it or use Wi-Fi. The Wi-Fi is an option. It's $500, so you have to order that at the time. But the cable can go into any one of them and go to a large display. It also has both photo and video capability with incredible storage. We can store up to 70 hours of video or over 80,000 photos. So it really is a high storage capability. And also it has an anti-fog technology so that as soon as you turn it on and the light appears, you're ready to go into your patient and not have to worry about it fogging up because of their heated breath. This device sells for $3,300. We often discount it to $29.95 and have different capability in that regard. We also sell a rigid stylet that someone might want to use. So this has the same shape and curve as a glide scope. Glide scopes can be, they have a new glide scope that's like $3,500, but then it uses each blade costs $25 to $40. Our system is about $3,000, but uses blades that are only $12.50. So we're a very high def, high capability, aggressive curve similar to the glide scope, yet we're only $12 every time they use it. So the Insight system, and once again I emphasize the system, can basically handle all their needs with, and they could share a display if they wanted, or buy a display for each device. The key thing here is, once again, may I schedule a time for you to try the video scope, or would you have interest in trying any of the flexible scopes or the entire system? And then see if they would like to try it, because that's what we want to do. This is a device that you definitely have to dress out and let them use it, do a couple intubations, and they'll be sold. We also sell IV poles and a IV pole mount that gives you power, and then we go into laryngoscopes. When I consider some of the areas of this catalog where we consider our focus points, I would say Insight is definitely one of them, Capnography is definitely one of them, and then laryngoscopes is the other one. We start off with conventional laryngoscopes, and we'll have a presentation just on laryngoscopes also to explain what's the difference between conventional and fiber optic. But basically conventional means that the light source is actually on the blade rather than in the handle. Fiber optic means the light source is in the handle, and then the light travels along a fiber optic bundle and then is presented to you. So we sell a lot of reusable blades and handles. We have a Bell Medical German profile. You'll hear a company called Heine and a company called Proper. Well, Heine blades are typically list price over $200, but they're still selling them maybe just under $200, and they're made in Germany. This Proper is also made in Germany, and we sell it, well actually this one is Bell Medical's version, and we sell it for $58. We have another version that's actually the Proper that we sell for $143. So my point is that if you're working in an environment where you see a lot of Heine being sold, the Heine can be an exact alternative to Heine at a significant savings would be the Proper, and then we would encourage the customer to at least try our German profile at $58 because they're paying sometimes $258 for a reusable. Now, the industry is going from reusable to disposable. We are a distributor for FlexiCare, but FlexiCare is also being distributed by Trianum, and often we don't have as much control over this, so we often sell this, but our customers buy it from us, but there's chances that we'll lose that business if it becomes a real big volume because they'll go to Trianum as a choice to it. So be aware that we have this as options, but the products that we sell more are two manufacturers that make a disposable system for us. This is our Carnegie surgical laryngoscopes, and this is our lead with disposable laryngoscope. This system over here is called our combo. It's actually conventional. In other words, the light source is on the end of the blade, and they're pre-connected and they're color-coded. So you'll get a Miller Zero, for example, for pediatric that will be paired with a pen light handle. The more adult size blades will be paired with a standard handle, and then some will be paired with a stubby handle. But that's conventional system, light source on the end. And if a hospital is going to be using a blade and handle and throwing both away, this is our least expensive option for them, is to use our combo. So they can save about $1 compared to buying the fiber optic. And in the fiber optic, once again, the light source is in the handle. The light travels along a fiber optic bundle and then is displayed at the end of that fiber optic bundle. So, and these have significant advantages also compared to our competition. But basically, the biggest advantage that we have over the market leader, and once again, the market leader is this FlexiCare system. The FlexiCare is an all-metal blade that isn't finished to the highest degree of quality, so they dip it in a heavy paint or lacquer. So it has a gray, shiny, painted look to it, high-gloss paint look to it. And some clinicians don't like it, especially their Miller blade has a curve on the bottom of it that allows the tongue to kind of flop off side to side. So whereas ours has a little flatter area, and that's really critical, especially in pediatrics and infants, but even in adults. You want to be able to, if you're a Miller person especially, this blade has some challenges because the blade, the tongue slips off the blade. Our Carnegie system has a flatter, if you will, base of the blade, and clinicians like it better. And then we have a gentle curve up on the Miller, and our Macintosh blade is basically very much similar to a reusable Macintosh. So of all the different blades, disposables that we sell, the Carnegie system is most like a reusable blade. So a lot of times the hospital will start off, they might view their problem is with their handles, because handles now, Joint Commission wants you to sterilize your handles and your blades. Well, blades are pretty easy to sterilize, but when you send a handle down to central supply, it is very difficult to have them come back reliably, because central supply will take them apart, they'll sterilize them, they'll put them back together, and then the ability for them to work reliably is reduced greatly. So as a result, what happens is you may have a hospital that'll start out, they might start off with disposable blades and use reusable handles. Then, or they might start off, for example, we have a renowned hospital in Reno where they started off with disposable handles because their blades were easy to sterilize and weren't having a problem with, but they were having problems with their handles. So it can be anything, or if they know they're going to throw both away, then we would lead them toward the combo because we get the best pricing on the combo. So this is an area where you want to ask the customer, what are you doing? What are you using now? Are you using reusable or disposable? And if they say, oh, we're using disposable, you would verify, are you using disposable blades and disposable handles? And a lot of them will say, oh, we're using disposable blades, but we're using reusable handles. Then you would have to ask, how are you cleaning your handles? Are you just wiping them down? Or are you sending them to central supply for sterilization? And if they say they're wiping them down, that's an opportunity for you to provide them samples and get them to order these, because the list price of this is only $8 versus they're paying $100 or more for a handle. And this is an aluminum handle that if they're wiping off their current reusable handles, that's not basically what JCO wants. But if they're wiping them off now, there's no reason they can't wipe off our disposable handle and reuse it for 30 days or longer. It gets us in the hospital, gets them using our product and liking it, and then we gradually get them on either of the systems as they move through the process of going totally disposable. Basically, everyone is going disposable laryngoscopes. So this is a big opportunity for you now, whether they've already chosen a vendor or they're in the process of doing it. But what you want to ask is, what are you using now? Make note of it. Can you bring me a sample of it? Can you show me what you're using? Take a picture of it, write down the product number, etc., and then ask how are they currently, if they're using any portion of this as reusable blades or handle, asking how are they cleaning those. And that's a key thing to make note of. If you have that information, what they're using now and how they're cleaning it, then you can move on and call me, and we'll develop a strategy for that hospital. This is big business, big revenue, big opportunity. We also sell MRI reusable blades, and we're working on getting an MRI disposable, so that's coming also. But we basically have a total solution for laryngoscopes. I might mention, if you're talking to a pediatric or infant children's hospital, or even an adult hospital, some of them will ask, oh, do you make a disposable, Phillips blade or disposable Wiss Hipple, or they'll mention an odd blade. And the nice thing about Bell Medical is that we, as a manufacturer, represent multiple companies, so we can get those unusual blades, Wiss Hipple and Phillips blades, in a disposable. They may be from a different company from this, but they'll be compatible with our handle, for example. So from Bell Medical, we have a total solution of whatever they want to do, whether they want to do total disposable or they want to do it in stages. We can handle their needs. That takes us off laryngoscopes, and now we're into airway devices such as LMAs. LMA stands for Laryngeal Mask Airway. And LMA of America, which was an English company, first introduced the LMA. And what the LMA is basically, rather than always intubating a patient with an endotracheal tube, if you know the procedure is only going to be about an hour long, they, in the past, would use a face mask, and they would hold the face mask over the patient's face and have to keep their hand there every time they squeezed the ventilation bag. And this was developed, and this is basically a mask that fits in the mouth. So once they put this in the mouth and inflated it, they no longer have to hold it. So it frees up their hands to do record keeping, give other drugs, that kind of thing. So a laryngeal mask airway, when they originally came out, they were all reusable. We still do sell reusables. The reusables were 100% silicone. Then what they did is they came out with a PVC. And LMA of America sells their reusables, by the way, for about $265 to $285 each. We sell our reusables for like $130 each. When they got to a disposable, and their reusable could only be used 40 times, and then they had to throw it away, and they had to keep records of it. So no one liked using the reusables. But there are still customers that are doing that. So now they've gone all to disposable, but a lot of them have gone to disposable PVC. And they don't seal as well. So almost every anesthesia provider that's been in this business for any length of time remembers using a silicone LMA that sealed very well. Now they have to use a PVC LMA that seals okay, but not ideally. And what's transitioned in this business is we now can provide a 100% silicone disposable LMA for under $9. In fact, our list price is $9, but we can sell these routinely in the $7.20 or $7.60 range. And our competition is selling a plastic or PVC LMA for $9 to $10. So once again, you would say, would you like to try a disposable all silicone LMA that we can provide you and guarantee you a cost savings? And hopefully they'll say yes. And then we would send you samples, and they would give it a try. We have a new silicone LMA that's called the Blockbuster, and it has the ability to blindly intubate. So it's an intubating LMA. We're still waiting on our intubation kits that come with this, but the tube is, the LMA itself is available. This would be considered a second generation LMA, similar to an iGel. It has a gastric channel these do not have gastric channels. So these would be the traditional LMAs that LMA of America is selling, and this one would be what we would call a second generation. LMA of America has something similar, but you can't intubate through it, but it has a curve like this, and it has a gastric channel, and it's called the Brain. They refer to it as the Brain because a Dr. Brain developed it. Okay. We have other options for silicone LMAs that can be less expensive. We also sell monitors. Now, we sell monitors from a company called Eden, but we also sell monitors now that are pre-owned of every manufacturer. So we can get Philips monitors, we can get GE monitors, and they're refurbished and pre-owned, and they're often at about a fraction of the cost of a new GE or a new Philips. These new devices are very competitively priced, and often we can compete our new price with a refurbished or pre-owned price. What's exciting right now is we're also going to have access to all of the Mindray monitors for surgery centers. So we'll not only sell Eden, but we'll also be able to sell Mindray. Once again, plus all the pre-owned monitors from Philips, GE, etc., and Mindray for that matter. So the nice thing about selling pre-owned when you're looking at monitors or anesthesia machines is you're able to ask the anesthesia provider or the customer, you know, what do you prefer? What do you have now? So we can make it compatible with it, and then we don't have to do a demo or a trial or anything like that. We just find what they prefer most. Okay? So monitoring can be a big business of ours. Speaking of monitoring, we have capnography monitors. This is the Nonin capnography monitor. It can have pulse ox and CO2 or just CO2 only. And this is an Eden handheld CO2 monitor. It can have pulse ox or be CO2 only. Most of the time we sell this with pulse ox and we sell this CO2 only. But these are also monitors that we will provide on consignment at no charge as the patient uses or as the customer uses our disposable nasal cannulas. So these can be at no charge or the customer can buy them. We have a monitor called M. Dolores. M. Dolores, M stands for monitor, Dolores stands for pain, and it basically monitors via 2 EKG specialized pads, monitors the level of comfort or discomfort the patient is experiencing during surgery. So this is for anesthetized intraoperative patients, and it helps gauge the amount of narcotic or opiates or non-opiates that you would deliver to a patient to handle their pain. So even though they're asleep, a patient, as they're doing surgery, will experience pain. Their blood pressure rate will go higher, their heart rate will go higher, and this monitor will reveal that. And basically the way it works is the higher the number, the more comfortable they are. The lower the number, the more potentially in pain they are. And if a patient goes down below 50, they will have some hemodynamic reactions such as increased heart rate, increased blood pressure, and this will alert them to it. The key advantage of this is as they go to their PACU, we can, or as they're about to leave the OR, I can look at this, and if I see that my patient's at 70 or higher, I know they don't need any additional pain medicine. Whereas most of the time, if it's a long procedure, like a 3-hour plus procedure, they don't really know where they are with regards to pain management, so they'll give that patient an extra dose of narcotic. That takes them to the PACU, and they're groggy, they can't wake up, and they don't have the turnover time that they want. They might even be groggy in the OR, and they might have to keep them in the OR longer. So this monitor basically monitors the comfort level of a patient and allows them, so if a customer is interested in doing low opioid analgesia, analgesia is the anesthesia word for pain, they would find this an interesting monitor to evaluate. Bell Medical sells needles. These are regional block needles. We sell the Gertie Marks needle. Gertie Marks needles are used often in labor and delivery. So if your anesthesia department covers labor and delivery, one of the things we have about the Gertie Marks is that we sell what's called a combo needle. So it's an epidural needle and a spinal needle. So when mothers are getting ready to, they come in and they're having contractions, the fastest way to relieve a contraction is to give them a spinal. So they'll do a combined spinal epidural technique. So they'll put the epidural needle in first, then they'll but they won't dose it. Then they'll put the spinal needle in, they'll dose it, the patient gets immediate relief. They'll take the spinal needle out, and then they'll put an epidural catheter in, and then they'll dose that as needed, or they'll put them on a pump so that the patient doesn't have any pain when they're going through their labor and delivery process. The other needles we sell have to do with a company called Havel's, and they're ultrasound-friendly needles for doing nerve blocks. Speaking of nerves and nerve stimulators, one of our key focus products is the Stim Pod quantitative train of 4 monitor. The Stim Pod is imported by Bell Medical, and we are the master distributor for all of the United States and Canada. It's actually manufactured in South Africa. It is the only quantitative train of 4 handheld monitor available. There are other nerve stimulators, but they are not quantitative. And what quantitative means is that they have, this device actually has an accelerometer. The accelerometer fits on the thumb or the big toe. When it fits on the thumb, you basically stimulate the ulnar nerve. And what you do is you get thumb movement, and the accelerometer measures that thumb movement and basically gives them percentages. So you'll see a series of bar graphs showing the 4 twitches. If the customer is completely paralyzed, the patient is completely paralyzed, the thumb won't move and it'll display 0 of 4. Then if you get 1 twitch, it'll display 1 of 4, 2 of 4, 3 of 4. Once it gets to that 4th twitch, it measures that 4th twitch compared to the 1st twitch, and that gives you a percentage. So if the 4th twitch is equal to the 1st twitch, that means that patient is almost no longer paralyzed, and they would get a number like 93%. And anything over 90% means that patient can be extubated safely. If they're at 40 or 50%, then that clinician either needs to use a reversal agent to reverse the paralytic, or they need to wait a little bit before they extubate the patient. So this prevents, using quantitative train of 4 prevents residual neuromuscular block experience in the PACU. The worst thing you can do in the PACU is actually go to the recovery room and have the patient be not breathing well, and anesthesia sometimes doesn't know, are they not breathing well because they still have a lot of anesthetic on board, do they have too much analgesia or opiates on board, or is there still residual paralytic on board? So they can take this device, go to the bedside in the PACU, put it on the ulnar nerve, test it, and they can say, all right, it's not the nerve block. It's not the rocuronium, for example. It must be anesthetic or too much analgesia, and then they would treat that patient accordingly. But basically, the idea scenario is for them to leave the OR at the correct percentage so that they know that there's no residual paralytic on board and they don't have to reintubate a patient in the PACU. So the Zavant Stim Pod 450 is a quantitative train of 4 monitor. Other stimulators out there are what they call subjective monitors, because the clinician is gauging the movement of the thumb and trying to interpret the difference between the 4th twitch and the 1st twitch. And basically, studies have shown that it is virtually impossible to reliably tell the difference between the 4th twitch and the 1st twitch when a patient is in that 40, 50, 60, 70% range. We can all see 0 of 4, 2 of 4, 3 of 4, but once you and maybe we can see a fade, but when they get to a fairly strong 4th movement, we can't tell the difference between the 1st and the 4th. Thus, we really can't objectively tell that that's 90%. As a result, the accelerometer does that for us. What's unique about ours is we have a 3-dimensional accelerometer, so the device does not need any calibration. It can be put on a patient immediately and work. Often people still will do what's called a baseline, but that's just to see that they got good electrode placement and good thumb movement. It's not a requirement of the monitor. So our monitor does not have to be calibrated for each patient. So that's the Stim Pod 450. We also have the Stim Pod 410 that is used primarily, or is used exclusively for nerve blocks, locating nerves and doing a regional block of that nerve. It's a completely different use than the 450, which also has the capability of the 410, so it can also do nerve blocks. But the 410 is dedicated for doing regional anesthesia. Regional anesthesia is like when they would do a block of the shoulder, for example, or the neck, that will then deaden the nerve in the wrist. They can do a corporal tunnel surgery, for example, and the patient can literally watch them doing surgery. So the point is that they can sedate them where they don't have to put them under a general when they're using a nerve block. Most nerve blocks are now done in conjunction with ultrasound. So as a result, this isn't as valuable of a product for us or for your customers. And typically when a hospital has 12 ORs, they'll buy one or two of these for their nerve block area, which is usually in pre-op holding. Yet when they embrace the idea of quantitative train of 4, they will buy one for every OR. We also have the Stim Pod 460. This is a device that is sold to anesthesia pain management, but it's primarily also sold to chiropractors, acupuncturists, and physical therapists. So it's kind of a different Stim Pod than would be used in an anesthesia catalog, but we wanted to put it there because it's basically a device that is for treating neuropathies, patients with chronic pain, migraine headaches, things like that. So we'll teach you more about that at a later date. We have a nerve block positioning device called, what is it called? The Boot. And the Boot basically lifts up the leg and allows them to get to the back of the knee to be able to do nerve blocks. And we actually sell a fairly amount of those. We also sell the traditional nerve stimulators. This is one that's made originally by LifeTech, which was purchased by Halyard. So Halyard sells 2 traditional nerve stimulators that do not have quantitative capability. They are subjective. They have little electrode balls so they can just go to your ulnar nerve, but then they're trying to observe what the thumb's doing and trying to make assessments that way. They're less expensive, but they also provide less information for the clinician. So these are from a company called Halyard. They're more expensive. This is one that's almost $1,700. That does have a display, but once again, it's not quantitative. So we provide a display and quantitative at much less than the Halyard. We also, from SunMed, sell 2 handheld devices. So if somebody wants just an inexpensive nerve stimulator and they don't care about the quantitative nature, we do have those devices available. Going alphabetically, now we're back to oxygen and everything. We don't really sell straight oxygen cannulas. We're always using monitoring cannulas. We have the Capnoxygen mask we talked about earlier. We have Blue Star or Comfort Soft is our lower cost nasal cannula, and it's a split cannula. So one side's providing oxygen and one side's delivering or sampling CO2, and that's kind of an industry standard. We have a couple other options than that, but and we can get very low pricing on this. Sometimes we have to do it via rebates, but the key is we can beat anybody. When you get to this page, you want to ask, you know, once again, what are you using for a mask? Are you MacGyvering an oxygen mask? This is basically the same cost as an oxygen mask, a sample line, and that IV catheter. And likewise, we guarantee cost savings on their nasal cannula. Find out, once again, what are they using now routinely for a monitoring cannula that monitors CO2 while delivering oxygen. Get the product number, and then we can develop a strategy. This shows, again, the procedural oxygen mask, or the Pom Mask, and the vanilla scented mask that's ideal for, once again, a MAC case or monitored anesthesia care. We do sell oxygen sensors for anesthesia machines and ventilators. We have positioning devices. This is called a Drape pillow. It's for the morbidly obese. It gets that patient in a position that allows you to intubate them. So we have a couple different options there, but that's called the Drape pillow. We sell pulse oximeters, both a digital oximeter that just fits on the finger, so it's very portable, and our newer ones actually have sound, so they'll give you the sound of the pulse, and they'll give you an alarm when the patient exceeds the alarms. And then we have handheld pulse oximeters. This section is kind of a respiratory section. I would not generally leave this catalog with respiratory unless they ask for it. Respiratory does get involved with laryngoscope blades too, but these are CPAP masks that are used primarily for, like I said, in respiratory. So if you're making a call in respiratory, we can send these individual pages. Obviously, if the respiratory therapist wants the catalog, we want to give it to them. But these, this is called a full face mask that covers the nose and the mouth, and this is called the Max Shield, which covers the eyes and the mouth and nose, and it gives positive pressure. It's for basically those that are not doing well on a nasal cannula and they don't do well on an oxygen mask, and they actually need assistance and a positive pressure as they inhale. Also for respiratory is a nebulizer. We call this the trigger neb, and from a spec standpoint, it meets and exceeds the market leader, which is a Monaghan that sells for $5, $6, and we're at $1.50. So we're considerably less expensive, but once again, those are respiratory devices that we can talk about at a later time. We do temperature monitoring products and basically stethoscope products for anesthesia. This is stylets again, which we kind of covered. Here's our syringe pump. A lot of customers are using an old style syringe pump that has a magnetic plate because it's super easy to use. This syringe pump is likewise very easy to use. It can be used in this case for propofol, and what's nice about it is anesthesia asked us to put a bolus button that gave him one button bolus pushing. So basically when you press the bolus button and then press it immediately and hold it, it will actually deliver a constant bolus while you're holding the button down. And it's super easy to use and it's very competitive. Our competition is more complicated, harder to use, and probably $1,000 more expensive. Once again, we can send you out a sample if someone says they'd be interested in trying it. You just simply at this point say, do you have any need for an easy-to-use syringe pump for propofol and other drugs? And if they say no, then you move on to the next page. If they say yes, then you schedule an evaluation. We do everything with temperature monitoring. This is a forehead temperature sensor, and we have multiple choices there. And then we have esophageal and skin temp. We also sell a ultrasound probe cover that's used primarily during nerve blocks by anesthesia. And the nice thing about this is basically right now what they're doing is they're putting gel on their probe cover, or they're putting gel in a bag, putting the probe in the bag, and then they're putting gel on top of the bag. So they're kind of double gelling, and it makes a big mess. With this system, you basically put the Safer-Sonic probe cover over the probe, and it has an adhesive that it heals with no bubble, adhesives that sticks to it with no bubbles with a very light 3M adhesive, and then you put the gel over that, and when you're finished, it gives you a better image as you're doing it, and then when you're finished, you just take the cover off, and you don't have to clean the probe. A lot of people are using Tegaderm, and that's bad for a probe. They're paying $60,000 for these ultrasounds, and then they're putting something that they're not supposed to be putting on a probe, and that damages the probe over time. With these, it's designed for an ultrasound probe. So that's called Safer-Sonics. We make Drape Clips. We have these made and put Bell Medical. You're welcome to ask for a case of these. There's like 24 in a box, and give one away at every anesthesia call if you like. But don't give more than that away because we do sell them. In the old days, the drug companies used to give these away. Now you cannot give these away, so we do sell them. And basically they attach to the IV poles in surgery and hold the drapes up to form a barrier between the surgeon and the surgery and the anesthesia provider. So those are the Drape Clips. We have a new device. If a hospital is getting ready to be inspected by the Joint Commission, they are almost all not meeting the requirements for labeling their syringes. So as a result, everybody's gone to pre-filled syringes, which are much more expensive and can create a lot of different waste. So this is called Vigilant Label System, and it basically puts a small printer in their operating room and gives them a barcode reader. They will take a shot of a barcode on their badge that will tell them this is Dr. Luter's, for example, and then they'll shoot a series of barcodes on the printer that mimics the surgery they're about to do. So it could be orthopedics, it could be GI, it could be labor and delivery, and they would click that, and then it will immediately print the labels that are associated with that surgery. The labels will have meet the requirements of JCO, which is have the surgeon's initials, the anesthesia provider's initials that drew up the drug, the date, and the time. Those are the things that aren't being done. This immediately does it, and then they're able to put the labels on the syringes. If they can take one or two drugs that they're currently getting in pre-filled syringes and go back to drawing them up, they save the cost of this printer, which is around $3,000. I'm very excited to tell you that we sell anesthesia machines, and now we sell both new and pre-owned anesthesia machines. There's pictured here a GE Estiva, a GE Aspire, there's a Draeger Fabius, and this is a Mindray machine. So we sell, these are all pre-owned, and the prices are just budgetary, but we now sell new Mindray A3, A5, and A7 machines, ambulatory surgery centers. So we've just gotten the approval for that. So when I get to this point, I just ask, do you have any budget or needs in the next 6 to 18 months for anesthesia machines or monitors for your OR or PACU? And see what they say. If they have plans for changing machines. What's nice about being able to say pre-owned, sell pre-owned and new is that we're able to, if it's pre-owned they want, like a surgery center, we're able to match what they're using right now. So if they got a Stevas and they're happy with a Stevas, we can get them a Stevas. If they have Aspires and they want more Aspires, we just find out what the specs they want, and we are able to price that out. And then once again, we can sell new Mindray or pre-owned refurbished Mindray. The back cover shows the Stim Pod again, and we mentioned, asked them if they'd like to evaluate that. And then we kind of conclude with kind of a summary of our key things. We're anesthesia supply specialists. We sell anesthesia machines. We provide anesthesia service. Capnography specialist. We also have the Insight flexible video scopes. We have patient monitors, and then we specialize in laryngoscopes. So that's Bell Medical. In a long version, but the key, once again, when you're presenting this catalog is to page through it and just ask them, do you have any needs for capnography? Do you have any needs for carts? What kind of so it kind of reminds you to ask the absorbent question. What kind of absorbent are you using now? So use the catalog, obviously presenting to an end user a little bit faster, but use it and don't just hand it to somebody and assume they're going to walk through it. You want to introduce yourself and Bell Medical and make sure that they know what Bell Medical offers, and encourage them to make note that if they're using any other catalog company, that you are local, and if they are using another catalog company, that catalog company is probably out of Florida or California or the Northeast, and even though we're shipping out of out of St. Louis, you're there to make sure locally everything goes fine with what they buy, and if they have a problem with it, you'll come in and swap it out or take care of them. So we guarantee a minimum of a 3% savings over any advertised catalog price. So there's other catalogs out there that might have their whole key is discounting and not having feet on the ground salespeople. Ours is fair pricing. You have the flexibility of reducing this pricing 5% if you need to, but it's all fair and reasonable pricing. If it's obviously a volume deal for laryngoscope blades or something like that, you would want to connect to the office and we'd work out some kind of discounting program for you. But make sure your customer knows that you're guaranteeing them price savings on any other catalog sale. Or in general, you want to be contacted and given the opportunity to be their vendor of choice. That's all I have as far as an overview of the catalog. Does anybody have any questions? Oh, I see 9 questions. Let's go through them real quick. No, it does not take over an hour to present this catalog. You normally would do it in about 10 minutes.